Good morning, everyone, and welcome to Zoning for Zucchinis, the city planner's role in nourishing communities. I'm Francisco Astorga, the Planning and Economic Development Director for Bountiful City, and I'm your moderator. I am not presenting today, but I'm moderating this session. Today, we'll explore how planning and public health intersect to shape the environments where Utahns live, eat, and thrive. Our presenter is Alycia Ducuara. She's the Executive Director of Get Healthy Utah. She earned a bachelor's in public health from BYU and a master's in health education and promotion from the University of Utah. She served 10 years with the Salt Lake County Health Department in chronic disease prevention. And she is also the president of USOPHE.
USOPHE, yep.
She'll share how Utah communities use mapping, bilingual surveys, healthy food walk, audits to connect zoning, transportation, equity, and access to nutritious, affordable food. Before I give her the time, how does this apply to us? I'd like you to think about these three items. Healthy communities are a core APA Utah theme, linking land use, transportation, and health outcomes. Second, planning decisions set the stage for grocery locations, farmers markets, community gardens, and healthy retail. And last, cross-sector partnerships, planning, public health, local organizations turn data into actions. Please join me in welcoming Alycia Ducuara.
Okay, awesome. Grateful to be here today. It's fun to be in a theater presenting, if that's a first for me. I'm glad the lights are on so that you don't get too tired in the dark. The depot was kind of hard. It was kind of dark over there. So, but excited for you to join and be a part of this discussion about zoning for zucchini. You know, ChatGPT gave me that title. I thought it was clever, so good job, ChatGPT. But again, yeah, I'm Alycia, and I have a background in public health, and so I'm not a fellow planner, but I'm a wannabe planner. If I could do two jobs at the same time, I'd be a public health and a planner. Anyone have, I know there are some planners out there that have some education in the public health sphere. Curious, do we have any public health people in the crowd? Okay, that's okay. I'll be your public health person here today. And my goal at Get Healthy Utah, we're a nonprofit. We've existed for about 10 years. And my passion and my goal is to help embed a health lens across all sectors. And so often during conference season, we're talking to all our different partners. We are trying to figure out how we can all work together to build healthy communities. And our mission at Get Healthy Utah is health is really big. And so as we're building healthy communities, the three areas that Get Healthy Utah focuses on is physical activity, active transportation, healthy eating, access to healthy food, and mental well-being with the focus on that social connectivity piece in our communities. And so those are kind of the three lenses that we focus on and try to work with our transportation partners, our planners, outdoor rec, our public health partners, our mayors, our elected officials, and trying to really work together to embed this healthy communities lens in all the work that we do. Our big initiative that we do all of this through is the Healthy Utah Community Designation. Raise your hand if you've heard of this designation. Okay, got some hands. I know Francisco said that he wrote the application for Bountiful. That was one of our 5 new designees last week at the Utah League of Cities and Towns Conference. So good job, Bountiful.
Thank you.
So we currently, this needs to be updated. We are now at 65 cities and towns since last week with our new awardees to the Utah League of Cities and Towns. So this designation has existed since 2020 in partnership with the League, and we have cities and towns do a coalition, have a letter of commitment from the mayor, and then they have to work on a certain number of strategies in those 3 buckets. And so as you can see, a lot of our cities and towns, active living makes a lot of sense. We're you in charge of the parks and transportation, bike lanes, sidewalks, green space, and so we have a lot of movement in that active living space. Mental health has been a huge priority for our cities and towns and our mayors in trying to look at how we can do suicide prevention efforts and really try to embed that social connection piece. Healthy food, you can see, is a little lower on the number of strategies because we did a survey recently with city officials and staff, and there wasn't as much confidence in what the role of a city can be in the healthy food space. And so really this past year, Get Healthy Utah is trying to have this focus on education and seeing where can we move the needle in terms of healthy eating and healthy food access. So we do an annual event, which was last month, and we talked all about healthy food access and healthy eating. So you'll get to have a little preview of some of the things we talked about at that event for those that weren't able to make it. So why does this matter? You hear the terms kind of in the space of food is food security versus nutrition security. Since the pandemic, our food insecurity rates have skyrocketed. We have now 11 to 12%, communities 20% of the population that are experiencing food security. They do not know where they're going to get their next meal. Our kiddos, 1 in 8 kids are experiencing food insecurity. And so looking at how we can improve access to food is very important. Get Healthy Utah, we embed the health lens onto it. It's important that everyone has food, but how about nutritious food? What's the quality and nutritional value of the food that we're giving to our residents? And so often when we think about food security, we have a lot of programs that might have grocery stores donating their leftover pastries and cakes and all of that, which is great. We still need food, but we want to look at how can we increase nutritional food access. So those fresh fruits and vegetables, those whole foods. And so we want to really think through this. In our community, do we have access to food versus nutritional food? So as we dive into that more, when we look at Utahns, we're not getting enough fruits and vegetables. And this is across the country. We are eating more processed foods. And that is having a huge impact on our health. And so you can see the rates, even adults, youth, kiddos, we have a lot of goals to improve the number of fruits and vegetables that we eat. And by having the lack of fresh produce and healthy foods, it is putting a burden on our system and our bodies and our healthcare system. So we're having increased rates of chronic conditions, diabetes, obesity, heart disease, and then not only is it impacting our physical health, but it's impacting our mental health. Our keynote speaker at our event last month talked about that connection between your gut and your brain. And that a lot of our mental health issues today is because we're not nourishing our bellies with the correct nutrients to make sure our bodies and our minds are functioning correctly. So this isn't just a physical health problem, it's a mental health problem. And we're seeing a lot of mental health issues increasing. And so we know if we can focus on healthy habits such as eating healthy foods and moving our bodies, we're going to improve our mental health as well. A report recently came out looking at those two pieces, physical activity, healthy eating. Those are both important. And this report said that actually what you eat is 10 times more impacting your health, specifically obesity, than physical activity. And so this is kind of that phrase, you can't outrun your diet. No matter how much physical activity we do, what we eat is really imperative to our health. And another article came out saying that now what kiddos are eating, over 60% of what kiddos are eating, and adults as well, is ultra processed. What's ultra processed? That is not real food. All of our things that we're processing, putting together in boxes and bags, a lot of that, the oils and all the different things that aren't real food and that are having a huge impact on our health. So what impacts healthy eating? Why are we here today? Why are you talking to us, Alycia, about health? We're planners over here. So when we're looking at health, we're like, okay, how can we improve healthy eating across Utah? And planners do have a role. Your role is on that access piece. What does accessibility look like in your communities when it comes to food? Do we have grocery stores? Do we have farmers markets? Do we have community gardens? Where are schools getting their food? Do we have farm to fork? Are we trying to get our farmers' food into our schools, into our workplaces, into our big institutions? And then what does the food retail look like in your communities? Utah has a reputation. Sugar, soda, crumble cookie on every corner. And that's not a great reputation to have as our rates of obesity and diabetes are increasing and increasing because of the type of retail we're bringing into our communities that kiddos are exposed to, choosing soda and cookies over some healthy foods. So that access piece is huge, contributing to our habits of healthy eating. And then we do know the consumption side as well. People have different preferences, we have different cultures, learned habits, knowledge, resources, and time, and so that's an important part too. It's not just about access. We also have to have some education, some programming on how we should choose things, how we can prepare things, and some of those different pieces as well. So it's important to have both those lenses when we talk about healthy food. So when we look in our communities, what's available, what's the affordability of what's available, and what's the appeal. So understanding our neighborhoods, especially cultural relevance with foods, is important. If we have certain supermarkets that aren't really utilized by our community members and they're wanting something that's, if we have a lot of Latino, Hispanic community members, having more of an ethnic market is relevant for them for what they need to purchase their food. So getting into strategies for planners. This is a report we did a couple years ago with the Utah Foundation, and we did a bunch of healthy community reports. So if you want to dive into a full, long report, you can access this on their website and our website as well. But it has some main key findings, and it kind of goes through the different strategies that you can look on, including some planning type strategies, but also programming as well. And so you can kind of see on here, the food insecurity rates, the different type of programs, and different pieces that we should work on. So I distilled it down into pulling out what are those strategies for a city planner. So first, assessment and mapping tools. Community food assessment and mapping is an important thing just to get you started. If you're like, what should I do for food access? Look at your community, map it out, assess. What type of food is available in your city or in your community? And then healthy walk audits. Who's done, we're doing mobility audits and mobility tools all day, today and yesterday. So doing those type of audits, but with the frame and lens of food, looking at food. As you're walking down the street, what's available? What is the marketing? What's being promoted? What can I access? GIS spatial analysis mapping to look at the distance for people to have to commute and get to these places, if they're walking, driving, biking, and where the community's at. So that first piece is all those assessment and mapping tools. Second, community engagement. And we just had a great keynote with youth engagement. That would be a great opportunity to engage the youth. So what opportunities are we doing to do workshops, having community food councils, neighborhood food action plans? These are all different things that cities have done to involve the community into talking about how we can improve our healthy food access. Then zoning and land use tools. We know that zoning codes dictate what we can put and where we can put it. And so looking at our zoning codes and are they allowing or encouraging us to bring in grocery stores, having a farmer's market, or communities, gardens, and more zones around our neighborhoods. And then looking at how we're overlaying the zones to incentivize or require healthy food retail in underserved areas. My wish and dream as developers are building these housing developments is to ask all the social determinants of health questions. As I build this housing complex, where are these residents going to get their food? Where are they accessing green space and parks? Where are the kiddos going to go to childcare? Where is the school? Where are the work sites? And so going through that list of how is this community going to live, and do they have the resources they need to be able to have good quality of life? And so embedding that healthy food piece. And as a lot of developers are, a lot of our open space and agricultural land is now being sold to developers, can we preserve any of those agricultural lands? Can we have a portion of it, they're now calling it agri-hoods, where we're protecting a part of the agricultural land and turning it into a neighborhood community garden. So we make sure we have a green space, a playground for the kiddos, but then having an agricultural piece for those members, community members, to have some gardening. And those are becoming really popular. Community gardens are like selling out the second they're open. So that goes to the agricultural ordinances and looking at what are we doing to support agriculture in our communities and protecting those spaces for gardens, greenhouses, small farms within our city limits. And then finally, the infrastructure environment piece. So as we're working on our plans, are we integrating access to food into the transportation and transit planning? How people are getting to the places they need to go to access food. And then looking at that walkability, the bikeability, the transportation piece to access the food outlets, incentives to bring in the healthy food retail, and wayfinding and signage are always fun to show you where the different places are, community gardens, and so forth. So that kind of gives you an overview of all the potential strategies that we could utilize as planners to help increase access to healthy food. So I'm going to kind of give you some examples of what this looks like. Who's heard of a food desert? Some hands, okay. How about food swamps? A little less, okay. So So these are terms we use as you're doing your mapping and assessment of your neighborhoods, identifying food deserts, which are areas that do not have any fresh, healthy, or affordable food nearby. Some of the national definitions are just a grocery store. If you have a grocery store within a mile in urban areas or within 2 miles or 10 miles in rural areas, there's different definitions depending on what you're using to define a food desert. And then a food swamp is, in addition to having few healthy options, maybe not having a grocery store, you also have a high concentration of fast food and convenience stores that offer mostly processed and unhealthy food. So I lived in a neighborhood for about 10 years where I was in a food desert and a food swamp. And we did a walking tour with Move Utah a few years back. And so the closest grocery store to me was over 2 miles away, and it was on a big road corridor that was not safe for walking and biking. Yet I was within probably 15 fast food places within 5-minute walk of my house. So if you are a family, busy, working mom, working parents, trying to get home from work, trying to figure out what dinner you're gonna do, what are you most likely going to do in a community that's 15 fast food restaurants and no grocery store? What our environment has dictates kind of our choices. And our motto at Get Healthy Utah is, how can we make the healthy choice the default choice and having access to these healthy foods? So again, looking at your retail, what is in your communities, giving yourself a score and how you can maybe do a little better on the healthy food side. As I was looking at food deserts, I found Salt Lake County has a page, and this is a QR code to their full mapping project back in 2020, looking at defining food deserts. And they had all these different data that they used to identify where food deserts were in Salt Lake County. And so on the left side, you can see this map just includes the analysis for supermarkets only on the left. And then the right side is the weighted overlay for food deserts that also include ethnic markets. And so by looking at some of the ethnic markets, that helped with some of the food desert pieces. There were a little less food deserts. And so it's kind of knowing what your community is. Maybe they don't need a grocery store, but having an ethnic market that they're going to use for their food is going to help satisfy that food desert and have access to what they need. This is a little more from that Salt Lake County example. So they said they looked at where are the severe food deserts. And on this little chart over here, you can see they looked at the poverty rate, the percentage of members without a car, and then they looked at renters, how many are renters, and then looked at some of those ethnic and racial groups in those communities. And so you can see they kind of highlighted a few food deserts that they thought were more severe. And this is kind of a picture of one of them where they looked at, you know, if you didn't have a car, it took you almost an hour by transit to get to the closest grocery store. And noticing that along that route, you pass multiple, they said junk food, that lines that longer route. So again, you're passing all of these other type of food choices that are closer to try to get to the healthy food or choice and access some of those groceries. So kind of thinking about that transportation piece as well. So this is real quick, just some examples of healthy food strategies that our Healthy Utah community designees have worked on over the past few years that get some excitement. Community members and residents want to have more healthy choices, and they love diving into the agricultural piece and having access to fresh fruits and vegetables. So Spanish Fork, their community garden, they prioritize low-income gardeners. As I mentioned, community gardens, when they release the plots, they're gone within a day. And a lot of them are people that know how to garden, and so they don't have a backyard or whatever, and so they need that community garden. But then those low-income communities that might not know how to garden aren't able to access it. So how are we able to promote and provide more community gardens, but then also provide some training and education along with it to help some of our community members that haven't gardened before, but that could really help with access. You can see here there's also some raised beds, and so thinking about those with disabilities, having ADA accessible type of beds for people to garden. Down in Springdale, they waive all the fees for their community garden so that all members in their community can have access to that garden. Casharam does classes where they're trying to teach about some of these healthy food, how to make bread and how to freeze dry, especially during the winter months. Hurricane also does local gardening classes, and tries to teach, how can we grow our own food? And then down in Moab, they focus more on the youth. And so they have a youth garden project where they're trying to partner with nonprofits and really educate the youth in growing their own food. Mill Creek has a high amount of refugees in some of their west side neighborhoods, and so they partner with IRC, New Roots, to help provide culturally relevant food and grow culturally relevant fruits and vegetables, and then have a farmer's market in those neighborhoods to be able to access that. And then that area doesn't have a grocery store. That's kind of where I lived, around kind of that South Salt Lake, Mill Creek area. And so this was able to bring this fresh produce to these neighborhoods that didn't have easy access to it. If community gardens is kind of a huge step, baby steps that a lot of cities are doing are some of these blessing boxes where they're trying to have these on the corners, and people are able to donate and community members can come and take what they need. And then they also, in Smithville, they did a sharing stand for excess produce. So those neighbors that do have their own gardens, or they're participating in a community garden but they don't need to eat all of that, they can take it and put it in these stands and others can grab it. In Tooele, they give away fruit trees to residents annually, and again have, I think USU Extension and others come in and teach how to take care of their fruit trees and be able to increase the agricultural pieces. And I think they're looking at an orchard as well in Tooele to kind of increase the access to fruits. And then some of our grocery store piece. Santaquin City Council offered financial incentives to attract Macy's into their community. We know Vineyard is our, one of the fastest growing communities that didn't have a grocery store, and then they were finally able to attract a grocery store and really look at what location made sense that was walkable for residents to get to. Manti passed an ordinance to allow backyard poultry during the egg price hikes when no one could get eggs, and everyone went out and bought chickens, but then they realized certain cities weren't allowing them to have chickens in their backyard. And so again, looking at some of our ordinances and allowing some of those pieces so that our residents can grow their own food or have their own eggs with their chickens. And then South Jordan had an ordinance to make it easier for residents to operate stands to sell homegrown produce. And then Woods Cross encourages healthy food options at all city functions. And then finally, Salt Lake City have a micro grant program where they give grants to increase healthy, affordable, and culturally relevant food choices. Residents can apply for a $250 grant if they need just a little bit to get going, if they want to start their own garden in their backyard, purchase some equipment to get going on a community garden. They can apply for a grant and be able to purchase that equipment so they can grow their own food. And then community groups have up to $5,000 grants to help with this as well. So there's a lot of quick ideas of kind of the sky's the limit when it comes to healthy food access and what you can bring into your communities to improve that. So my final example that I want to share, when I was writing my abstract for this presentation today, we were trying to get a grant through the Robert Wood Johnson Foundation, and we were able to get it. We were awarded that in July, and so this is a demonstration project we're doing in Price City, looking more into some of the data pieces of how we can look at healthy food access. And so the purpose of the grant is to really provide support for collecting and analyzing and using data to catalyze action on certain issues. And food insecurity and healthy food access, especially in our rural towns, is a huge priority. And so we know that data will help us identify needs, prioritize needs, and choose the best solution. So we're working in Price and kind of some areas outside of Price. We just are barely getting started on this project. And our goal for this project is to answer the questions of what are the barriers to accessing food in this area in Price. And the grant wanted us to focus on a certain subgroup. And so we're looking particularly at our Latino Hispanic population and low income communities. And then we're diving into how does the availability, accessibility, and quality of healthy food vary across the neighborhoods in Price, and what roles do transportation and the built environment play in limiting or facilitating access to healthy food in Price. So we just barely started a couple months ago, and it's a 9-month grant, so we're kind of in the second stage. First, we did a data review of what already exists out there, started to do some community mapping, looking at what data we have, and then we're working on a survey and some other events to try to gather some new information. We're going to conduct a healthy food walk audit and then compile all the different data into a final report to then give to some of the stakeholders in that area. So some of our partners include Carbon Medical, the Southeast Health Department, CERTA, USU Extension. We have some students from universities helping with this. And then Latinos in Action. Latinos in Action is a youth group through the high school. So I, again, loved the keynote of kind of involving the youth. And so it's kind of helping us involve the youth in high school and also helping access the families, our Latino Hispanic families that oftentimes don't have a voice in a lot of the planning and decisions and aren't kind of represented in a lot of the city meetings. And so we're really wanting to target and making sure that we can get their voice and their perspectives around healthy food access to share with our stakeholders. So this is some screenshots of our epidemiologist at the health department is working to pull some mapping data together and overlay some of the different data pieces for us to kind of paint a picture of what does healthy food access look like in Price and the surrounding areas. So you can see here she's highlighted a certain census tract, but she's trying to put pins, and I know this is kind of small, although this is a big screen, so maybe you can see it better. But you can see different pins, so she tried to put where the supermarkets are and grocery stores, where convenient grocery stores are, healthy food. She's trying to figure out the food swamp thing. That's not something a lot of people have looked into with data, and so it's not really available. So she's trying to see how we could start mapping and looking at food swamps instead of the unhealthy food pieces. So she's still working on that. But then you can see the overlay, the colors are food insecurity. And so kind of the darker the color, the higher the food security. And so as you drill down kind of on the left side of the screen, in this specific track that she highlighted, the food security rate is 19.7%, so almost 20%. 1 in 5 community members in that census tract don't know where their next meal is going to come from. 1 in 5. And so as we look into the census tract, we can also look at additional barriers. So you see those different colored bar graphs, and so some of those things you can click on are percentage that report fair or poor health, disability, those that receive food stamps, those that have transportation barriers, housing insecurity, utility services threatened, and lack of social or emotional support. And then you can also look at health-related measures. Again, you can't see all of them, but you can start clicking into what do the rates look like for diabetes or heart disease in these specific neighborhoods, and kind of mapping how healthy food access is impacting those different health metrics. And then that's another thing that she's also looking at, kind of that food desert piece. And so as you click on certain census blocks, you can see in this census block, we look at the walkability. You cannot get to a grocery store within a 10-minute walk, but you can drive to 3 grocery stores within a 10-minute drive. So it's interesting in a rural area. In urban, it's a little easier to look at kind of that walkability and bikeability, where rural, it's a lot more spread out. So we're trying to figure out what makes sense for food deserts and how far these grocery stores are to these certain neighborhoods. So our next step was creating a community survey and trying to just ask we always want to ask 1,000 questions. So trying to narrow it down to what are those questions we really want to ask the community around healthy food access. So you can see I kind of zoomed in on the English version, but then there's a Spanish version as well. And we're trying to get out to community events. So a couple weeks ago, there was a couple health fairs and community events that we were trying to hand out these surveys at and get more information from the community about their experience. Where do they usually get their food? How do they get their food? How difficult is it to find food that's relevant for them? How worried are they about accessing food? And what are they most interested to have in their community? That's where you kind of ask, do you want a community garden or a produce exchange or farmers markets or classes? What would help you access healthy food? And then we're going to try these healthy food walk audits. We watched a webinar, and actually through APA, in Maryland, they did these healthy food walk audits. And so we're like, oh, this sounds really cool, doing these walk audits, but embedding the health lens onto it. And so your typical walk audits kind of look at that walkability piece, street conditions, environment. But when you do the healthy food walk audit, you look at, okay, if you were to walk or bike from a certain neighborhood to a food outlet, what is that experience? And what is that food environment like? So we're working on doing a healthy food fair and neighborhood walk in November with the community, and we're focusing on our Latinos in Action high schoolers. And so we're going to ask our high schoolers, we're going to do this event. It's going to be really fun. We're going to have food and games. We're going to teach about healthy food. We're going to have taste testing, try some different fruits and vegetables, get the kiddos involved, get the parents involved. And we're hoping that our Latino in Action students are going to invite their families and their neighbors to come to this event that we'll have mostly in Spanish, and really get them out and excited to come learn about healthy food. And so the first part of it will be these educational data collecting activities. We're going to do some food mapping activities. We'll have that survey there. And then the second half, we're going to invite them out to do these walk audits. And so we're going to divide into different routes, and we're going to go into different parts of the neighborhoods and that are close to kind of food outlets and start talking about, what does this feel like? What is this food environment? And give each member a clipboard and a pen and kind of write down some checklists of what they're seeing and their thoughts about healthy food in that area. And so part of the walk audit tool, some of the questions that are on this, and we're kind of developing it right now and finalizing it, is for them to observe what food options are available on this route. And then what are healthy options and what are the unhealthy options? And then what's the quality, the pricing, the visibility, and the promotion? You know, do we have 5-for-1 candy bar thing over here? Or do we have any fruit and vegetable stuff? Which not really, because it's hard to promote fruits and vegetables. We're going to figure it out. But identify the strengths and the gaps along these routes for healthy food access. And then our hope after this project, as we do some of these events and these healthy food walk audits and the surveys and the mapping, pull it all together into a report and have some recommendations that we provide back to a lot of our decision makers, CERTA, Price City, other outlying cities, to see how can we really look at the future in terms of healthy food access in this area. And we're hoping this can be duplicated in other communities and see how we can do more of this in Utah. So let's see where we're at. Okay, so we have I want to have a little bit of time for group discussion on some questions, and then we'll kind of come back together and I have some polling questions and some final share out. But before I dive into the group discussion questions, any questions for me at this time? Yes?
I don't even know how to phrase this.
Just giving you the microphone.
Thank you. So I'm on the Planning Commission for a community here in Utah that's a fairly affluent community. And I have observed in my community and others that there is a tremendous housing shortage, and there seems to be an effort to build on every square inch of dirt.
Yeah.
And I love what you're saying about community gardens. I've seen them in other communities. I love it from a lot of perspectives, not just the nutritional perspective, but it's a tiny bit of open space and a tiny bit of effort to create something that's alive. And I'm wondering, just in bringing that concept back to our planning commission and our city planners, how do you do that when land is so expensive? How do you even begin to discuss the idea of a community garden when that piece of land would be so valuable to a developer, and the developers just seem to want to gobble up every inch of dirt and put something profitable on it? I just wonder what your perspective on that would be.
Yeah, that's a great question, and something that we come up with everything, with our developing, is how can we have all these different resources and pieces. And I think it really comes down to, as your planners, trying to negotiate. I know we have a lot of negotiations with developers on, okay, we've had developers where we will get a couple extra units on this different thing if you put in this park or some pickleball courts or something. And so I'm seeing that a lot in the physical activity and green space. And so just adding to the agricultural piece, how can we protect or have part of this development be for agriculture, a community garden, or looking at our lots and seeing if we have enough space just for having the members houses having some part of land that they could do for their own gardening. And so I think it's going to have to really be a balance, kind of what can we push back on as cities of like, no, this is important to our city. We want to make sure that this development and these housing has access to some agricultural space, and we're not going to let that go, and that's one of the requirements. And so you kind of have to look at your ordinances and your planning things of like, what can you require? And again, I'm not a planner, so Francisco, feel free to jump in. But I think really looking at those benefits and talking about it. Public health, I'm looking through a health lens all day long, so that's my world. How is this impacting the health? How is it impacting the health? And so as we can have champions in planning commissions and with our city planners, who's that advocate to talk about the health implications of kind of how we're building, and maybe use some of those data points and how important this is to our residents. Residents want this, and it's for our overall quality of life. And like you said, it's not just nutritional benefit, but our social connectedness. We're in an epidemic of isolation, trying to get members out into the community and work together on a little piece of land and have that open space. And so I think it's just having that narrative, those talking points, including it in, see if we can make it required or not, but talking about some of those benefits and how we can just protect with some of these housing pieces this land. And I get it, because it's profitable to have housing on every bit of dirt. So Francisco,
and I have two comments to share an anecdote from the Bountiful city, in that we had some residents that really wanted to have a community garden, and they didn't have the ability to purchase a lot or land or anything. So they informally created this group, which then over time evolved to the Gardens Growing Good. That's their name of their LLC. And they found a champion through our city council, where through probably a year's time's discussion with the other council members and the mayor, the city donated a small portion adjacent to the city cemetery for a community garden in Bountiful. And that was one of my strategies that I was able to fulfill for this specific category. So what I'm saying is that sometimes we need to get creative, and I'm not telling you this is what you have to do for your community. In the planning world, we understand that not every regulation that, say, my friends in Sandy have, I could just take over and put in Bountiful. We all have to find what our secret sauce and what our recipe is. And the other thought, more regarding to planning, is that if we don't think about these items, if we don't think about this stuff, then parcels and property, it's going to get developed without it. So we need to find creative ways to see if perhaps we could incentivize that, hey, Mr. Developer, you can have 1 or 2 more units, but you have to provide this community garden. And I'm just giving you a very general idea. I'm not saying that's it. I don't know what that density is. You have to go through that exercise. But there are ways that I believe that through, if it's supported by our comprehensive general plan, if it's then implemented in our zoning code, I think we could have better tools to think about this stuff. Because if we don't, then it's developed and we're done. I'm moving on. I think there was one more question, or did you want to move on to the group?
Yeah, we can do another question and then we'll do the group.
It was you, right?
Oh, yeah.
Thank you for that question, by the way.
Yeah.
I'm going to stand by you for that.
So kind of adding on to what you were saying, as planners, we work with a lot of developers on large scale housing projects. And as part of those projects, there's a certain percentage of open space that's typically required, a certain percentage of amenities and things like that. And so we can rewrite our codes to require community gardens in these open spaces that they have to provide anyways. And a lot of them typically have a mix of like single family homes and townhomes and other things like other high density housing. And so it's like the single family homes, they probably could put in their own garden in their yard. But for those, high density housing, let's try and plan for having community gardens in our open space areas to allow other people within the community to have access to those resources.
Yeah. Thank you. Yeah,
And,
great comment.
and I just want to add one more comment regarding that. Is there anybody from Park City here? Okay, great. I worked there many years ago. And in Park City, we had open space requirements, but we determined that we didn't have usable open space. We required open space just to check a box. And often it was, I think we do have Park City here. Anyways, that we try to get creative to see how we could have usable open space, and I think this is a great opportunity for such.
Yeah, I love that.
I just wanted to add that.
Yeah, that's great. Great comment. So we'll have about 9 minutes. We go quick. You have 4 questions. You probably won't get to all of them, so you can pick your favorite. But just want to kind of get some conversation. I love the thoughts already that we've talked about. But kind of, find some partners or create some small groups. Give you about 8 to 9 minutes to talk through which questions you want to do. And then we'll have some polling, get some feedback from you at the end to see how can we work together, how can Get Healthy Utah help provide more resources or thoughts that you can bring to your planning commissions and your plans so that we can create some more healthy, nourishing communities. So the questions you can talk through are, do you think your communities have disparities in healthy food access? Why or why not? What current planning efforts or strategies are your communities using that hinder or improve access to healthy food? What tools or strategies do you feel are realistic, from that list that I talked through? And then what support or resources do your communities need to help implement more of these healthy food access strategies? So like I said, I have some polling questions at the end that you're going to kind of submit your ideas, but I want to give you just a few minutes to talk with your partners in small groups, and we'll kind of come back together at about 11:05-ish. So give you a few minutes to discuss.
Are you doing
Okay,
stand-up?
if you want to take out your phones and scan this QR code, and then I'll move into my browser and activate it. But this is the bigger version of the QR code. This is probably too big. Let me go into the other one too. I forget how big this screen is behind me.
My big head got in the way.
They kept zooming in to take a picture.
All right, that might be a little better.
It
Try
was
that.
looking for something aesthetically pleasing. That's what I was doing.
Okay, so this
The
first
AI
question
in your
is kind of the
phone
one that
knows
was on
what's up.
the group discussion. So does the community you work in have disparities in access to healthy food from your perspective? You can put yes, no, or if you feel like you can't click yes or no, you can put unsure. Still loading, okay. Yeah, I'm seeing 23 people. I feel like there's more than 23 in this room. So yeah, if you want to scan, get in. Okay. So that's kind of your primer question. So we can see there's probably every neighborhood, there's probably opportunities to improve. So, yes, we probably have opportunities to really look at improving access to healthy food. So the next question is, do you currently consider healthy food access in your planning processes and strategies?
Let's be honest.
Is this even anywhere, that you bring up at all? Okay, so there's lots of opportunities here. And I think that is just one of the biggest things, just
Wow.
talking about it, bringing it up. Hey, this is an awesome development. Where are they going to get their food? We're looking at what's close by for food. Or hey, here's some, restaurants that want to come in. Let's look at that. What does our food retail look like? Okay. This is a longer one. It's ranking. So you're going to have to slide your little finger up. Sometimes you can move your phone horizontally if that works better. But what planning tools and strategies are you most interested in using? So these are kind of the ones I talked through. The mapping, assessment, doing a walk audit, doing community engagement, looking at your zoning codes, agricultural ordinances, integrating it into your transportation and planning, or incentives for healthy food development. So you can kind of move it in order of what the top is what you're most interested in. And once you have it in the order that you like, you can hit submit. So this takes a little more finessing on your phone. So we'll give a little more time on this one. So far we have zoning codes and agricultural ordinances, incentives for healthy food retail, got some mapping, okay, I know we were close to 35. I'll give it another 30 seconds if you want to submit. So it looks like zoning codes. So we're taking a look at those again. your ordinances, especially for agriculture, and food assessment and mapping. Okay. And the last question is an open-ended one. So this is where you can throw whatever thoughts you want in here for us to read later. What resources, support, what do we need to help kind of make this more a part of our everyday thing, where we're implementing healthy food access strategies, we're thinking about this in our planning, you know, are there talking points? Do you need some more data to bring this up at your planning meetings? What do you need that would be helpful for us to kind of really bring this lens to our healthy community planning? Okay, so feel free, I'll leave this open, but happy to open up for comments, questions. We have about 6 to 7 minutes. If you had thoughts that you talked about in your group that you want to bring up or ideas, we have the last few minutes to discuss.
Would anybody like to share? Oh, come on, guys. I don't want to have to pick on people. Okay, I'll pick on Mike. There you go.
So health is typically, health, at least from a practical standpoint, seems to be held at the county level, like county board of health. There doesn't seem to be, I've never really thought about it in my planning profession, honestly. That's why it kind of intrigued me to attend the session. It's got me thinking a lot about that and how we could partner with Board of Health. And are they looking at those types of things at their expertise level, and how are we working together? Do you have experiences working with Board of Health and working with local communities to improve some of these health outcomes in communities?
Yeah, that's a great question. Yeah, and I think our Healthy Utah Community designation is kind of one of those frameworks to start bringing health down to the local level. We do know our health departments and health districts are more at that county and regional level, but they don't have the bandwidth to really be the boots on the ground into our small communities and cities. So that's one reason to Get Healthy Utah developed that designation, to create a framework of, hey, what can cities do to create their own city coalitions and bring a lot of health departments will send a person to be on the city coalition, health coalition, so they can bring that perspective of, oh, here's what the county can support and so forth. But it's hard with the bandwidth of county and regions to really be able to do this on the city level. And so we're trying to connect. We have them as resources. So we are telling health departments, talk to your cities. Try to look at what existing task force or city committees they can add to, or create this health coalition and have these different members from the county be there. A lot of them have grants they're working on that they're supposed to help kind of with some of these pieces. But with our planning stuff, a lot of the times our boards of health and our health departments aren't plugged into that planning piece. And so that's where we're trying at Get Healthy Utah to help bring this message to each sector that makes a lot of decisions that impact health, where health departments or others are not there and don't have that voice. So we're trying to bridge that gap, encouraging our health and boards of health and health department to be at these meetings, go to the planning meetings. And I know back in 2017, I want to bring it back again. We had the Planners for Health come and we did a big training where health departments and planners came in the same room. And we started discussing how can we collaborate more. And that's something I want to bring back. How can we have these conversations and bridge kind of what's happening on the health side with the planning side? So I think there's a lot of opportunities, but the designation's a good place to start of a framework you can build off of.
Thanks for the question, Mike. I'm going to put Brad on the spot. He was talking about zoning, I think, a few minutes ago. Share your thoughts, please.
Yeah, so we recently had our city manager and economic development staff meet with just a broker about attracting more restaurants in the city. And one of the things that was really interesting is that the broker, as we met with him, he said actually a lot of the pushback that we're getting from attracting anybody to your city is that you have a lot of drive-through restaurants. And so that is actually a deterrent for any of the brick and mortar and sit-down type restaurants that, not to say all of them provide healthy food, but you might have healthier options than you're going to have with a drive-through. And so it was really interesting and eye-opening because from an economic development standpoint, the city wants to bring in those businesses because we know long-term it's going to be better for the city, but it also wraps into this healthy food option. And so discussing internally, we already have lots of areas, and looking at our city and our zoning code, that where we've already got a lot of areas that are a food swamp, and so then how can we take these swamps and say, all right, we've already got enough. Now in areas we're going to have development, that we're going to have healthier options. We're going to push these other things out. Not to say that we don't want the free market to still do its thing, but that's part of why we have zoning, is to say, yeah, the free market, you can do your thing, but these are the places that we know are going to be best for our community.
Thank you.
Thanks. All right, I have a question, and actually, I'm gonna give them the question.
Okay.
Okay, let's just say that your city manager comes up to you and says, "Hey, I found $10,000, and I need you to help me out in our city becoming more of a nourishing community. Just $10,000. What could you do with that money?" We're just gonna give it to staff. No. What are we gonna do? What would we do with that initial money? You could just shout it out. I don't want to go up the. Jason in the back.
I think the first step would be talking to your Parks Department and seeing what space may already be available to include some infrastructure.
So Jason says is speaking with your Parks Department to see what space is available. Keep going, Jason.
Yeah, I mean, I think that's a great start to understand what opportunities you have to start to build community gardens. If you don't have that, it may be engaging in a study to identify where you could locate community gardens and or look to improve food access.
Gotcha. So for the sake of time, Jason, I'm just going to summarize real quick. You would work with the Parks Department to see where you could get things moving, and I think you said if there's not such opportunity, maybe create a study, use this 10K to see if you could start a community garden somewhere. Let's go to our expert real quick, just to wrap up.
Yeah. I encourage all of you to really consider those strategies. If you're not already plugged in to Get Healthy Utah, we have a newsletter. We have a general newsletter and then a Healthy Utah community newsletter. You can sign up for both and then unsubscribe for the ones you don't want to. But we are always looking. We're having webinars. We're talking about this. We're talking about what strategies you can work on. So stay connected with us. Strategies that our cities, especially in healthy food access, the top two are those community gardens and farmers markets. So those are the two kind of pieces that we're really seeing, and so kind of looking back at what your community is providing and how you can improve that. And then, like I said, we're doing this demonstration project in Price, so hopefully we'll be able to report that next year. And please reach out, let us know. I think planning, public health, we're just friends and we just need to work more together. So feel free to reach out to me and see how we can keep working together and build healthy communities. Thank you so much.
Yeah, and just one more thought. Sorry. Just one more thought. One more thought here. Let me ask you one more question. When is the best time to plant a tree? No, wait.
10 years ago.
20 years ago. When's the second best time to plant a tree? Today. So with that said, let's think about what we've learned today, and let's try to incorporate these principles in what we do, in that what we do has long-term consequences. Thank you, Alycia, for your presentation. And please enjoy the rest of the conference.